Okay. This next week and a half or so, semester exams, we're going to talk about growth and development. And we've got, actually, it's kind of a little mini psychology unit, is what we'll actually be talking about. We'll talk about some different psychology theories and people who've developed these theories. It's pretty interesting, I think. It's something kind of like an intro to psychology class. This is like what you learn in the very beginning. Anyway, so lots of time for discussion and lots of, there's a lot that goes with this. It's just just do lots of discussion. It's kind of subjective. It's not a lot of, theories. When we start talking about theories on growth and development, a theory is just this, it's kind of like a pattern or something that somebody has recognized as this is the way that things occur. So we're going to talk about a couple of learning theories later this week and cognitive theories. And anyways, those are we'll talk about some different terminology as we go through here. Thursday, we'll do some discussion. We're going to read a couple of theories and go from there. We'll talk about growth charts later this week, kind of plot ourselves on growth charts, and let's go from there. We'll probably start up. I think we'll have the infection unit whenever we get back, and we'll pretty soon after we get back from Christmas break, and we'll go and do the teaching, talk about hand washing and do teaching about hand washing at the elementary and things like that. Pretty fun. But I like to do this one before we do that so that you guys can know. We'll talk about growth and development, and that way some of you guys may be teaching to Head Start kids, some of you guys may be teaching to 4th and 5th graders. You teach Head Start a lot different than you teach kids in 5th grade. And so we'll talk about that now, and then that way those are ways that you can be preparing for those to do that. So, okay, so when we hear the word growth, we're talking about growth and development. We'll talk about some other things in a minute. Growth is like that, more of a physical change. And when we're referring to it in these notes. So growth is actually the physical change in size. So they're actually growing. Versus development is more like our ability to mature in our thinking and our processing. I mean, right, we don't think the same as we did. I mean, you learn things differently than you did when you were in 6th grade, and you think about things differently, you interact differently. All of those ways, we don't realize that we're doing it, but those things change as we get older and learn more about our environment, learn more about ourselves. All of those things, we kind of go through these stages. We don't realize it because we're in the middle of it, but we do. So there's usually 4 areas of development that we talk about. So we have our physical development, right, changes that occur as we grow. Our intellectual or cognitive development. So when you hear, whenever you hear the word cognitive, think that's like your ability to learn, or like your processing, how you process things. Okay, so when you hear that term, because you'll hear me say that, you'll hear it in here. Cognitive is just your ability to learn, process. It's how you think. Okay, so like when you're young, everything's pretty concrete. Like that, if you tell a child that, I don't know, what is something that you might tell them? Their teeth are going to fall out if they eat candy. Okay, what do they think? Yeah, they think if I eat this piece of candy, my teeth are going to fall out of my head. And that's not really what it means, right? But a 3-year-old might not understand that versus, a 10-year-old who's like, okay, well, they're not really going to fall out, but maybe, whatever. So that's, that's a cognitive function, their ability to process more and more abstract ideas. Psycho-emotional development, so our emotions, how we feel about things, right? A 3-year-old is going to share their feelings differently, hopefully, than a 10-year-old. Okay, hopefully when my child is 10, she doesn't still kick her legs at me when she's upset. Okay, if she does, there's something else going on. She hasn't, emotionally, she needs to be able to, show her anger in a different way than she did when she's 3. That should change along the way. And then social development is what?
Like,
Yeah, how we interact with people, right? Our relationships that we have with people. And so that should change as we get older. Okay, so healthcare workers says need to be familiar with each developmental stage so that we can recognize maladaptive behavior. What's maladaptive behavior? What is mal? Do it? Bad. Mal is bad, right? We know that. So maladaptive.
So if they can't adapt very
Could
well
be
to their
bad.
situation.
But yeah, it's just their inability. It's like maladaptive behaviors would be behaviors that show that they can adapt well, like that, like a 10-year-old throwing a tantrum on the floor. Okay, like a 2-year-old would. You would expect a 2 or 3-year-old to throw a tantrum on the floor. You would not expect a 10 or 12-year-old to throw a tantrum on the floor. That clues you in that there's something going on. That would be a maladaptive behavior. Okay. Or maybe something happens to you, so it doesn't even have to be something that's so outright physical like that. Maybe, a maladaptive behavior could be, I don't know, lying, for example. So someone, they can't cope with what they're doing, and so they, lie about everything, or they can't cope with whatever's going on, and so their behavior. Does that make sense? It doesn't have to necessarily be like a physical thing. But as healthcare workers, we have to recognize when there's something not right. Okay, so if I'm working at the pediatrician's office and a 10-year-old comes in and they've started wetting the bed, a 10-year-old shouldn't normally wet the bed. So that clues me in that that's some kind of maladaptive behavior. There's something else going on in their life. Maybe they're really stressed. Maybe they're getting bullied at school. Maybe there's some kind of abuse at home. Maybe they really do have some kind of physical problem. That's a maladaptive behavior. I should know that as a healthcare worker. A 10-year-old should not be wetting the bed on a consistent basis. Maybe one night they have a bad dream and get scared. I don't know. But, on a regular basis, that should not occur. And so that's an example. If I don't recognize that as a healthcare worker, that's something I should be able to do. So you have to know kind of where everybody should be in order to know if there's something wrong. And not just that, like I think about starting IVs. Okay, so when I worked at Children's, okay, if I was going to start an IV on a 2-year-old, okay, I did that process a lot differently than I did on a 14-year-old that came in. Okay, a 14-year-old, I would say, hey, we're going to have to start an IV. You're going to put a needle in your arm. It's going to give you medicine. The needle's not going to stay. It's just a piece of plastic that stays in your arm. I'm going to explain it to him, give him a few minutes to process it, right? Go get my stuff, come back in. Whereas a 2-year-old, I'm going to go outside the room. I'm going to get everything ready. So all I have to do is go in and get it done, okay? Because a 2-year-old, if I go in and tell them I'm going to put a needle in their arm, okay, they're going to flip out if I go away and come back. So I'm going to stand outside the room, get my whole tray ready. I'm going to walk in. I'm going to say, we're going to have to poke you in the arm. It's only going to be for a minute, and then you're going to have this tape on your arm. I'm going to get it done right that second. Right? I'm not going to give them a whole lot of time to get crazy about it. So that's why it's important that we know how to handle things at different stages. Okay. So first stage, now, and these stages are not set in stone, okay, as far as generalized theory, okay. These are be on the back of the church.
It goes to 2. Yeah.
Oh. Okay, we'll follow along. Yeah, it is to copy the back of it. Follow along, and I will copy the back of it. Okay. So again, these stages are not set in stone as far as like it's black and white. This is the way it is. There's a lot of fuzziness between these stages. Okay, there's a lot of gray areas between these stages. So that's think that. Don't necessarily, like I said, don't take these as different. You go to a psychology class, it may look a little bit different. Generally speaking, it's going to be the same, but just know that these are not set in stone. Okay, so newborn. Typical language is they cry. That's pretty much the only, until they get to be about 3 or 4 or 5 months old, they don't really make any other sounds except for crying. Okay, and their cry tells you what? I'm hungry,
I'm tired.
diaper's dirty, sleepy. What'd you say? Maybe they want to be held. Okay, their cry says that they need something. Okay, and that's pretty much the extent of it. They usually eat every 2 to 3 hours. Okay, day and night. They don't just their tummy doesn't turn off at night. And that kind of depends on what kind of meals they get. Breastfed babies, it's usually every 2 to 3 hours. Formula-fed babies, it's usually 3 to 4. Kind of depends. That's because breast milk doesn't have as much, I want to say filler, but like formula, they tend to hang on to formula for a little bit longer because there's kind of more, it fills them up for longer because there's just more to it. Whereas the breast milk is like exactly what they need, you know. So that's one reason that they can last a little longer between meals with formula. Uncoordinated movements. Okay, right? Their arms are like spastic. They're like all over the place. Okay, Micah's he's gotten to where he's 5 months old. He was 5 months yesterday. And he can hold stuff and bring it to his mouth, you know. But if you dangle it in front of him, he can grab it, but it takes him a little bit to find it, you know. And he's a lot less spastic. When he was a newborn, you know, everything's like jerky movements. And now it's a lot smoother. No teeth. Of course, you have those exceptions. I've heard of people having babies born with teeth. Poor vision. Focusing range is 8 to 12 inches. Did y'all know that? That newborns can only see, they can only focus 8 to 12 inches away from their face. So, you know, when you walk in and there's like a baby across the room and you're like, oh, the baby's smiling at me or whatever, they're probably not smiling. They probably just have gas or something. I don't know. But 8 to 12 inches is actually where they can focus. Now, it gets better. Like Micah's vision is a lot better now than it was when he was first born. But here's what I think is so cool. Think about how our bodies are designed, and where do we hold a baby? In our arms. How far away is our face from theirs? Probably about 8 to 12 inches. Isn't it cool? You know, I think that's awesome. I think that's cool that, you know, we're made in such a way that just perfectly fits, that they can see us, see our faces from there. Cool. And, you know, poor vision, now I'm not saying they can see perfectly even at 8 to 12 inches, but they can, you know, you're more than just like a shape or a fuzzy spot. They can focus on you. Usually they double their weight by 9 months, okay, and it could be earlier than that. Let's see, response to human voice and touch. So they respond to it. Now I'm not saying, obviously they're not going to talk back at that point, but they will respond to it. They turn their head to hear, or they notice when you touch them. And that's really important, okay? It's really important that newborn babies are held and that they're talked to. That sets up, and we'll talk about this Thursday when we get to the theories, but that really sets the pace for them for later in life. They're not touched. They say that there's actually a syndrome, and I don't know the name of it, for kids that were not held or touched as a baby, and it makes them have some serious sensory issues when they get older. It's really, it's you know, babies who are left in their crib by themselves for hours upon hours. So, now kids can have, I'm not saying all kids with sensory issues had that happen. Don't hear me say that. Because that can happen, you know, even if they are touched and held and everything, but more often than not, a baby who's not touched and held and talked to as an infant and just left alone for hours upon hours is going to have some kind of psychological problems later on. Again, not saying that we're, you know, both directions. Okay, infancy. It says begins to focus on objects more clearly so they can pick out things, right? Not so. Typically your newborn stage, it kind of depends on who you talk to, but usually it's just that first month of life. When people refer to a newborn, it's usually that first like 28 days. Sometimes people stretch it on up to 3 months. I actually read this book when I had Hannah called The Happiest Baby on the Block, and I don't agree with all of his theories because he's an evolutionist, and that's not something that I believe in, but it is a theory. But he talks about it a lot in the book. But I do think he talks about how because the way our bodies are, that babies really would like to stay in the womb like another 3 months, that they could really use a 12-month gestation. But our bodies, we just can't hold them that long. So, but anyways, but one of the things that they really like is to be swaddled and wrapped up really tight. And he talks about 5 things that he uses to calm a baby down. And now with Hannah, it took all 5 things because she screamed every night from like 5 till 10 o'clock every single night, cried for the first 6 months. But swaddling is one. And so, wrap her up as tight as I could wrap her. I could barely even put fingers in, and she'd just be like as tight as she could. And that's because in the womb, that's how it is. They're really enclosed and in the womb. And then the other thing is shushing, like a loud shushing noise, like a vacuum cleaner or a hair dryer. Because you think about their noise inside the womb, they hear blood flow all the time. There's a constant sound. Hear the heartbeat, they hear blood flow constantly all around them. And they hear noise. They know that when you're asleep and when you're not, because they can hear noise on the outside. Most babies know their mother's voice already when they're born because they've heard it, What else does he say? Shushing, sucking is another one, like a pacifier, or nursing. Shushing. Side lying or stomach lying, he says, is better for him. And then what was the other? Swinging, movement, some kind of moving. You think about it when they're in the womb, they're moving all the time. They move with the mom. Everywhere she goes, they take them on. He says that babies who are in cultures where they carry their babies a lot, like carry them on their back or carry them in a sling or whatever, that those babies tend to have less colic than other babies because they're held all the time and they're swaddled all the time in that wrap. And it's kind of interesting. So, anyways. So more infancy, they do get better motor skills. When you see that word motor, what is it talking about? Movement, right? Motor and movement. So they're able to grasp objects, like I was saying with Micah. They begin to make meaningful sounds, so they start making noise on purpose. Even Micah at 5 months, like if you can have a conversation with him, like you can talk to him and he'll like coo back, and you talk to him and coo back, or he'll like blow bubbles or whatever. That's his way of having a conversation. And even later in infancy, they start to actually make, say mama or dada or whatever. Make spaces. That already, like Micah, I can stick my tongue out at him and he sticks his tongue right back at me. It's so funny. They start to laugh, mimic faces, like I just said, and then they start to have separation anxiety. They like to be away from their mom or their dad or anybody else. And then they get separation anxiety again when they're 2. Okay, so 1-year-old kind of changed from kind of that baby look, that kind of fat baby look, chubby cheeks, chubby legs, round, to more of a toddler look, that leaner, because what are they doing now? They started to walk, right? So usually right around 1, sometimes some babies start before 9 or 10 months, some babies it's not till 14 and 16 months, but they'll start walking in that time period. And they shed a lot of weight in that time period because they're so much more active. Begins to walk and talk. They have the ability for passive language, so they have a better understanding of what's going on around them and things that are said, around them. So really important that you're careful, what's on the TV or what's said outside the door of a patient who's this age, because they'll pick up on key words. A tentative sense of independence, so they're trying to test it out, right? Testing out the waters. What can I do? What can I get away with? And then start to explore. The 2-year-old begins to communicate verbally, and it's just all their 2-year, they're usually, at least in that 2nd year, they really develop language very, very quickly. Usually can speak in 3 to 4 word sentences. Really famous for negative behavior, saying no to everything, temper tantrums, terrible twos. I don't know why they say terrible twos, because there's like also, I think 3s are going to be worse, I feel like, anyways. maybe not, but we're almost there. They play side by side with other kids, but they won't necessarily play with them at 2. Now, they will a little bit. They might hand them a toy, but they're not going to like do, somebody's going to take a Barbie and somebody else is going to take a Barbie and interact with them. They're not going to do that. But they might sit beside each other and each play with the Barbie. Really good imitators, definitely. My child is like the ultimate movie quote sayer. I don't understand how I can't remember what I'm doing for the day. And she has like all these movie quotes. I mean, she can watch the movie like once and she's got the whole song memorized. I don't understand. She can sing all of Let It Go, the whole song. The other day, my mom, what was that? She got in trouble. What did she do? I think she ate something my mom told her not to eat, and she was like, "Let it go." Well, we're like, okay. It's funny because she also knows when to say it. Okay, 3-year-olds typically want to be just like their parents, and I have so seen this. And Hannah's not quite 3, but she's almost there. She has this baby doll, and everything that we do with Micah, she does with this baby doll. So she picks it up, and she's like, "Oh, it's okay, baby. It's okay." She'll put it on their shoulder. She'll be burping him. She'll be like, "It's okay. It's okay." She says that all the time.
How old is she?
She's 2. She'll be 3 in February. And she swaddles him up, and changes his diaper. And she's like, "Shoo, that diaper's stinky," is what she'll tell him. So, and she thinks she has to use real wipes. I can't just give her a wash rag and say, "Use this to wipe your baby." Oh no, we have to have real wipes. Which she gets in trouble for, but still does it anyway. Okay, their vocabulary and pronunciation continue to expand, so their talking will get better and better. And this is a clue. If their language is not getting more and more clear at this point, that's something you may want to talk to a doctor about, because maybe they have something else going on. Kids can start speech they can start speech even long before this if they need to. And it's a lot easier if they get started with like speech therapy if they're going to have some kind of speech issue when they're younger than when they're older. It's a lot easier to correct the younger they are. Climb stairs with alternating feet. Okay, before this, kids typically, they'll go up one step, put the other one, go up another step, put the other foot there. Whereas 3-year-olds, this just shows coordination. They're getting much more coordinated. So now they can actually go up steps, one foot at a time. And they can briefly stand on one foot. So again, their coordination gets better. 4-year-olds, their sentences become more complex. They speak well enough that people can actually understand them, somebody besides their mom. Some kids are hard to understand. They get a really crazy imagination. And it's so, the line between what's real and imaginary, sometimes they can't really tell. And that's why it's important that when you speak to kids this age, or you're presenting something like when you guys go to do, your hand washing or whatever, that, you make sure this is not a good age to talk sarcastically to them, because they're going to take whatever you say, and that's the way it is. They can only think that way. But imagination, they'll come up with crazy stories. They develop fears, and they can do this earlier. Maybe they're scared of the dark, they're scared of dogs, they're scared of whatever. I'm scared of dogs. Okay, 5-year-olds can hop on one foot and skip. So again, better coordination. I know y'all have this one video. Skip, hop on one foot. So more and more coordination is what we're seeing. They can accurately copy things. So hand-eye coordination is much better, right? And this is when they typically start kindergarten. So you want them to be able to write, to look at something and be able to draw it and write it. They can begin to read. They can begin before that, really. And then they begin to be social with other children. So they can really interact and play better with other kids. They can have friendships, whereas before, more just like they're in the same room, Okay, late childhood or pre-adolescence. So this is like your elementary school years. So their muscles are getting more well-developed. develop complex motor skills, so able to draw and write and do like fine-tune things with your hands. They go from doing independent activities to same-sex group activities. Usually, not always. It's not always same-sex, but usually that's where it begins. You know, you have your group of girls and group of boys or whatever. Acceptance by peers is very important, and that becomes increasingly important. When you agree, every year kind of seems to get more important. And then parental approval, though, is still really important. Usually elementary kids, they want to please their parents, right?
I read something about that on Facebook the other day. About like the 5 things that kids with their parents do or something like that.
Yeah, they want their approval. And you know, really, that doesn't go away. It just becomes less important. I don't know if it's important. It just becomes less, what's the word? I don't know. Your peers kind of overtake your parents at some point, but that parental approval doesn't really go away. You always still want their approval. Even when you're my age, you still want it. Okay, adolescence. Y'all should know about this. Traumatic life stage for child and parent. Anybody agree? Has its traumatic moments, right? Luckily, it doesn't last forever.
Like I can't learn something to wear one day. It's just traumatic.
Yeah, everything is traumatic, right? Not everything. Everybody's got different things that are more traumatic than others. So, but here's one thing to think about. Whenever you know, sometimes I think we have some things that everybody has their own things in their lives that are traumatic. And regardless of how severe it seems to one person or another, like your own drama is still your own drama, and it's still your own, you know. I had a pastor say one time, he said, grief is whatever grieves you. Like, you know, you can't judge levels of grief or levels of trauma or levels of emotions or feelings between people. Like, if something's bothering them, then it's bothering them, and to them, that's what's going on in their life, regardless of if it seems meaningless to the next person. Does that make sense?
And like if your dog dies and somebody says you can't be sad, my grandma just died, they can still be sad about it.
Right, exactly. You know, just because
right. Yours might be worse in your opinion.
Right, it doesn't make them feel any different, you know. So that's always something, you know, I don't know, there's always something to keep in mind. Just because your situation seems worse than someone else's, that doesn't make their situation not bad. So, anyways, because everybody's got something going on all the time, right? Everybody's always has something going on, something they're worried about, something they're stressed about, something they're dealing with. And keep that in mind as you know, you approach people, because everybody's got something going on, especially these days, holidays. Okay, puberty occurs, which carries its own trauma with it, physically and emotionally. Extremely concerned with appearance. Even if you think you're not concerned with your appearance, you usually still have some concern for it. Or if you're like me, I'm like, I want to be so not concerned with my appearance. No, I'm not saying like this at this point in my life. I went through this stage, though. I wanted to be so not concerned with appearance that I was concerned with not being concerned. Does that make sense? It's like I wanted to be anti-concerned with my appearance, so then I was really concerned about being anti-concerned.
You're making an effort.
But you were really concerned about what you look like.
Exactly. But I was concerned about trying to not be like worried about what I'm like. So like I said, everybody's got their own trauma that they're dealing with. You know what I'm saying? It's like you get on this pendulum this way, and then it's like you want to be anti, so you go on this pendulum this way, and it's really no different than being over here. It's just on the opposite end. Got to find the happy medium in there. Trying to establish self-identity, right? You guys trying to figure out who you are, what you want to be, what's important to you, what's not important to you, right? Kind of determining all of that stuff at this stage in your life. And it will change. It goes in and out, up and down. And then confrontations with authority. So who are some of your authorities in your life right now? Parents? Who else? Teachers. Probably
Adults in general.
yeah, adults in general, depending on who they are. Yeah, and everybody find confrontations at times. I'm really worried about what's going to happen when Hannah gets up into school because I feel like we're just alike, and it could be bad news. Butt heads, we already butt heads sometimes. It's just you. All right, young adults. Physical development is usually complete. Guys is usually later than girls. Typically girls, as far as physical development is concerned, usually done by, late teens, 18-ish, 19-ish. Guys will keep growing until they're like 25. Or can keep growing until they're 25. What is that? And I always see this, especially with my husband doing college ministry, I'll see like kids will go away to college for like the first year, boys, not really girls so much. And then they'll come back in the summer and all of a sudden they've still grown like 4 inches, And then like, you're not teen, you're still growing like that. But, emotional maturation continues to develop. So still, kind of reining in the emotions. So it's like adolescence is super emotional stage. And then it kind of slows down a little bit as you keep going. Usually I've learned at this point to accept responsibility for actions and accept criticism. Kind of depends on the person, but definitely better able to do that. You just become, the older you get, usually the less we call it egocentric or it's really self-centered. That's like the psychology word for self-centeredness. There's just, I don't know, as adolescents, that's just something that you have because you're worried about your parents, you're worried about your peers and what everybody thinks of you. And then the older you get, the more concerned you are, outside of yourself. That's just the nature of it. That's just the stages. Usually at this point can learn how to benefit from your errors, right? So you learn how to process those. And then socially progresses from age-related peer groups to peer groups with other people who have similar interests, right? So at this stage, you guys, you kind of stick with your own age group. And some of that's just because there's a big difference between, a 12-year-old and a 18-year-old, a huge difference. Whereas once you get into your 20s and 30s, I have some of my closest friends are like 40, they may be 10 years older than me. But because we have the same interests, that becomes more important than that age factor. Does that make sense? So that kind of, you see that change. Okay, middle adulthood. So physical changes begin to occur, right? Their hair starts getting thinner, starts turning gray. Sometimes it happens earlier than you want it to. I would not consider myself middle adulthood, but maybe I'm getting there. I don't know. Wrinkles start to come, hearing and vision decrease. That's a normal thing with aging. Vision gets worse and hearing gets worse. Muscles lose their tone. So your tone is just like, your muscle tone is just your muscle's normal ability to just stay contracted kind of all the time. Okay? But as you get older, they kind of lose that. They're not as strong.
Our arms can get all
flabby. Just like this. Typical concerns at this stage of life are their kids, their job, health becomes a concern at this point, job security, parents, their parents are aging, like what are we going to do with our parents? Are we going to, how do we take care of them, get them to their doctor's appointments and so forth. And then just a fear of aging. You kind of, when you guys are your age or even young adulthood, you kind of have this invincible kind of idea. You don't think about death because it seems like really far away, and it just seems like that's not really something that you worry about. But then all of a sudden you get to this middle age and you're like, oh my gosh, half of my life is over, So those are things that people deal with at that age. And then love and acceptance still have a major role, still really important. Okay, late adulthood. This is the fastest growing age bracket of society. Why is that? The baby boomers can't talk. Y'all remember talking about that at the beginning of the year? Okay. Why? What are some reasons, besides just the baby boomer fact that there was a lot of people born during that time period? Why else is this a fast growing bracket?
Because now they're aging.
There's like a lot more medical and technological advances that keeps them alive longer.
Right. People are staying alive longer, right? 30 years ago, there are some of the treatments and stuff that we have now, we didn't have back then. So people are living longer. And they're living sicker. Like, sick people who before would have died quickly, these days we have treatments that make them live longer, whether they're older or not,
Like cancer with chemo.
Right. Physical deterioration is another concern. So, right, brittle bones, they get, what's the disease? What's the brittle bone disease? Osteoporosis. Osteoporosis. And then poor coordination, right? So you notice sometimes they'll shake their muscles. They lose some of their dexterity in their hands or their ability to do, like fine motor skills. Ever notice handwriting? People who are elderly, really, a lot of times it's really shaky. They've lost some of that dexterity. Some memory problems. Some memory problems are normal. That's a normal part of aging. Now, there are diseases, dementia and Alzheimer's. Those are abnormal memory loss. That's more so than normal. Coping with retirement, and then just figuring out a way to still stay busy. A lot of people get really depressed when they retire because here they've been busy their whole lives, and then all of a sudden they're not, and their kids, don't live at home anymore. You see that a lot. You see some depression with that. Very concerned with health and their finances, right? Health is a big concern because their health is dwindling, and then their finances because they're having to spend a lot of money on their health, right? But not just that. They want to make sure that they leave, money or their estate or whatever to their family, and do they have everything in order and so forth. Significant number become depressed, and the suicide rate is really high in this age group. Surprised by that? Lots of depression and lots of a lot of elderly people are on depression medication. You would probably be surprised, and I can't put a percentage to it, but I think you would be surprised at it. And that's just part of that stage. Is you learn how to deal with things as they come along. But a lot of people get, for one, they get really lonely. The older they get, and it just life has changed. They kind of get this retrospective look. Like what should I have done different, and things to think about. Okay, those are the stages. Let's look at these real quick. So individual differences to take into consideration. These are other things while we're looking at growth and development and how we handle our clients or our patients as healthcare workers. These are some other things to take into consideration besides just the growth and development part of it all. So cultural and subcultural differences. Cultural differences is a big one. Okay, not everybody thinks the same way that you do and the same way that your family does. That's just the way it is. Probably most people don't, because everybody's family, you're raised with certain ideas and certain things that are right and certain things that are wrong, and you do things as a family or you don't do things as a family or whatever. And it's really important that as a healthcare worker, when you are helping someone, you don't put your own ideas, your own thoughts, and push those on to another person. It's really important, that you don't expect them necessarily to do things the same way that you would. Now, I'm not telling you can't share with them what you believe or what you think, but you have to pick your time wisely, and you still have to be respectful of their thoughts and their ideas and their time. And it's really important that you do that. And cultural differences, there's lots of different things. Trying to think of I used to have this. I remember talking, I don't remember what culture it was, but like there's one culture that it's really rude to make eye contact. And right in our culture, you feel like if someone doesn't make eye contact with you, that they're not telling you the truth and they're not being sincere. But then there are some cultures where if you make eye contact, it's really rude and it's really disrespectful. Some cultures where women don't talk to men and men don't talk to women. And so those are all things, you can't just be offended and think that you're always right or your culture is right and theirs isn't. You just, sometimes you kind of pick and choose and your battles. Sometimes you can't be culturally appropriate because the law won't allow it. There may be some legal issues, but as best you can, you always want to be as sensitive to that as you can. This makes me think of, I probably told y'all this story. I was working at Children's. I had this there were Sudanese refugees. Their family came in and their baby was really sick. I told y'all this story before. The newborn baby, like less than a month old, came in with a high fever. And I don't know what the baby ended up having because I didn't see all the test results once the baby got moved to the floor. Probably meningitis would have been my guess, but I'm not really sure. But they said that, one, there was a major language barrier because we didn't have a Sudanese interpreter who worked there all the time, So we had to use this phone system. And one of the things that they kept wanting us to do was to pull the baby's teeth. Well, this is a newborn, so we didn't have any teeth. But they said that's what they do. They have fever, they pull their teeth. Don't know the whole story or the whole thing behind that, but that's why they brought him in, because they couldn't pull his teeth because he didn't have it. And it was so hard to get them to understand, why we had to do blood work and we had to check urine and then we had to do a spinal tap because that's how you check for meningitis. And trying to explain a spinal tap on a newborn, is not easy to do, with someone with such a language barrier. And, they still had that cultural mindset. They didn't understand the technology that we were using and so forth. So it took a long time to explain. It's always worth the time to explain, and you'll do your best to explain and go from there. But anyways, you just never know. And you can't just say, no, that's stupid, like that makes no sense. But to them, that's true because that's their culture. So, ethnic differences. So again, it's just not, regardless of what you think or how you grew up, everybody's the same. And when it comes, when you're treating them, it can't look any different regardless of whatever it is. Religious differences, again, you can't push your beliefs on them regardless of whether or not you believe the way they do. Just because you don't believe the same as them doesn't mean you treat them any different than you would anybody else. You'll know this. Physical differences, personalities, you can't always assume that okay, this person who's in pain, the most horrible pain they've ever felt, may cry. This person who's in the most horrible pain they've ever felt may just sit there and do nothing. You just have to go with what they say. You can't always, think on that. So, okay, that's it. So I will see you guys Thursday. Will y'all keep that door open for me?